Hey, did you know that you cannot have a disc bulge or a disc herniation unless your spine is out of alignment? So if you hear of somebody having a disc bulge or herniation, or if you have a disc bulge or herniation, the very first place that you should go is to a chiropractor. I've heard stories before in the past where you don't go to a chiropractor if you get a bulge or herniation, they'll make it worse. No, as long as the chiropractor knows what he's doing, the very first place you should go is to a chiropractor. So let me explain. So you have your spine, just spinal bones, then you have the disc, which is like a shock absorber between the spinal bones and allows a space for this nerve to come out. Well, if your spine's in a right alignment, which should be straight from the front, and then from the side, you're supposed to have these spinal curves, that means the weight is going to be distributed on the joints of the spine, not on the disc. So even though the spinal discs are like a shock absorber, they provide a cushion for movement, they're not designed to bear the weight. Now, if your spine comes out of alignment, we lose the curve in our neck, or the spine shifts to the side, now you're going to get pressure onto that disc instead of the joint where it's supposed to be. And this is where you can get a bulge or herniation. And a bulge is where, kind of like a jelly donut, if you push in the jelly donut and some jelly can squirt out the side, that's where herniation, when the jelly actually squirts out. A bulge is where like it kind of creates a little bubble on the side of that disc. And so the best thing you can do is get that spine moving better and back into position, get the pressure off that disc. And sometimes that, if it's totally herniated, the material is not going to get reabsorbed back in. But if there's a bulge, it can get reabsorbed back in. So you're not going to continue to have problems in that area. So the very best thing you can do is, if you have a bulge or herniation, to get in a better of alignment, of course, through chiropractic adjustment, and then do your spinal rehab, doing your wobble seat, doing your traction, again, help keep pressure off there and get the spine moving the right way. Then you are going to avoid the area things that are going to exacerbate in the first place. Also, same things that are going to prevent it. So if you're spending long hours at a computer, bent over, or looking down at your phone, those are things that are going to lead to degeneration of the spine, as well as bulges and herniation. So if you hear of somebody or yourself bulge or herniation, the first thing you have to think about is what caused that in the first place. Discs don't just go bad for no reason, right? And if that's the case, then all of your discs should go bad at the same time. It has nothing to do with aging. It doesn't have to do with your bad disc. It has to do with the abnormal pressure on the disc. So again, when it comes to your health, you always want to look back at the cause of the problem, not treating the symptom. So if you do a disc surgery or injections or something like that, that's treating the symptom. Now, very rarely, if somebody has a disc issue, it can require surgery. That's a pretty rare amount of the time. Most of the time it can be fixed or at least dealt with on a conservative measure. But whenever it comes to your health, again, you always want to look at the cause of the problem, not treating the symptom.